Hi guys, welcome back to my channel. My name is Des and today we are doing a new weight loss surgery complication update video. Yes, you heard that right. I have had weight loss surgery and I'm now experiencing some complications 4 years down the road, but they have been going on for 3 years now and we're finally starting to address it. So if you have been following along with this little journey, I have 2 other update videos on it and I just had a procedure done last week, so things are finally moving. We are on the road to recovery and I finally have a new update for you guys. So where we left off was that I was going to need a new gastroendoscopy done, and that is where they put a camera down your throat and they just check out your upper GI tract, and they just need to take the photos in order for you to actually be able to get your surgery. It's just kind of how insurance works. So once you have these images taken, then they see, the issue, and then they say, yes, she does need surgery. But it's all a process. So the good news is that after I had my gastroendoscopy last week with my surgeon, we got new images taken and we were able to compare them to the last gastroendoscopy that I had. So in 2020, September 2020 is when I had my very first gastroendoscopy, and he took the images and he saw that I did have an ulcer in the accessory stomach. I had gastric bypass. So there are 2 stomachs. One is like the stomach that is used to process my food, and the other one is just an accessory stomach that's there just kind of hanging out. I know it's really weird, but that's just how it is, the new anatomy of my body after weight loss surgery. So how my surgeon was explaining it is that in my accessory stomach where the ulcer is, there is still all of like the acid receptors, and they are shooting out acid as they do, and they tend to shoot out more acid as I stress. And this last year I've been dealing with like way higher levels of stress that I'm still kind of working on a daily basis to manage and like maintain, but I know that that has played a really big factor in all of this. But what's happening is that there's an overproduction of acid in my accessory stomach, and there's no food in there for the acid to be breaking down. So it's just breaking down the lining of my stomach, which caused an ulcer that has cratered and flappy material. Like, it's so bad, it's just flowing around in there. Like, there's just parts of my stomach cratered and flapping around. And as you can imagine, that is extremely painful. I mean, this has really been affecting my life in so many ways that most people don't know how bad it's affecting me, because I don't know, I just never want to be that person that's just like, oh, like poor me, I'm in so much pain all the time. Like, if anything, I'm just trying to fix it. Like, I'm like, oh my gosh, like how do I keep going on with my life? Like, it does get in the way of a lot of my daily activities. There are some days where I can't even stand up at the kitchen to like wash a dish, and I'm just like, oh my gosh, I can't even like sit up right now. So this has been a really long ongoing issue. It's very painful. It affects me every single day, every single night. I don't sleep longer than 2.5 to 3 hours until the pain wakes me up again. So I am just so ready to get this issue taken care of. So we were able to compare the last images, and fortunately there was no like further progression. It didn't get any worse in the last 2 years. And the reason why no action was taken last time was because they just forgot to follow up with me. So we did the gastroendoscopy, and after that was done, they prescribed me omeprazole to help with the acid production, and I've been taking that ever since. So I've been taking my omeprazole for 2 years now, and that's it. But when I saw him in January, he mentioned that, oh, after those last images were taken, we absolutely needed to schedule you for surgery, but I guess there was just never any follow-up. So we are picking up the pieces, and now I am making sure to be the squeaky wheel to get the oil. And I've been doing all my follow-ups, and even after this last gastroendoscopy, I called while I was like still drugged up on anesthesia, like,
I just want to make sure like I'm gonna get a follow-up.
And I don't even really remember leaving that message, but I know I did. And then I left 3 other follow-up messages and I never heard anything. But finally, a week later, I got to actually talk to someone at the office, and they brought me in for a follow-up because they didn't want to discuss any of the results that we got from my gastroendoscopy over the phone. So I had to go back out to California and just go for my follow-up appointment with my surgeon. And some other interesting things that we found out in that appointment was that my stomach hasn't stretched out, and I was like just kind of curious about that because I'm 4.5 years out, 4 years out, and I'm just like curious, like, is my stomach still like the size of a normal gastric bypass patient's? And so just a fun little tidbit of it all was that he said that my stomach hasn't stretched out, and he was like really impressed by it, that I've been able to maintain and like manage the proper portion controls this far out. So if that is you and you're like, oh my gosh, like, can you stretch out your stomach? You know, am I stretching out my stomach 4 years out? Honestly, I pretty much never eat over 4 to 5 ounces. I do still get full at that point. And I think that it's because I did practice my portion control so consistently in the beginning. But that's just a fun fact. The other bit was that he said that the ulcer is still cratered with flappy material. It just didn't get any worse than the last time, but it's very evident that the carafate and the omeprazole even working together is not healing it, which means that I'm gonna have to get the ulcer surgically removed. So here we are going in for another surgery. Do you guys know how many surgeries I've had in the last 4 years? I am so nervous. The last time I went under anesthesia, I don't know what it was. We still don't know what it was. We are assuming it was latex, but I had such a bad allergic reaction. I ended up being out of the gym for 6 months and I gained some weight and it like really messed me up. And I just really hope that that's not gonna be the case again, because obviously I wanna get my health back, but having these setbacks constantly, it is just not the move. It's not the vibe. I don't like it, but obviously I'm willing to do whatever it takes to get healthy and happy again. So that's where we're at. Now that I visited my surgeon and we talked about what we saw on the gastroendoscopy, the next thing that I'm scheduled for is an EKG, and I couldn't even be seen for that until the middle of September. It is July 26th today. So my next appointment to be able to get this removed is gonna be the EKG, and I gotta just go do that little stress test. That's what you do, is you ride a bike and you go to your surgeon's office dressed out in your leggings and your sports bra or athletic clothes, and you go and just sit on the stress bike. And then after that, I'm gonna have to get some blood work and then a bone density test. Once those 3 things are completed, then I can finally get scheduled for surgery. So given the timeline that I've been seeing with this office, I'm assuming that my surgery will be coming at some point in like November, which I mean, I'm stoked about. I'm nervous about some things that are coming up with that, but obviously I know that I have to prioritize my health, and everyone's always like, Des, you're doing a million things, like you need to stop, you need to slow down. And I know that, trust me, I'm trying really hard to like slow it down and like keep a pace and keep my mental good. It has been the biggest struggle, if I'm being quite honest. It is definitely a struggle, but I'm pretty sure the only things that I have going on in November is my twin sister's having a baby. So I'll probably be going to Denver, Colorado for that weekend when she's due. And then also we have a bariatric award show, which if you guys haven't heard about it, Our Sleeve Life podcast, they are amazing. They are putting on an entire awards show. So if you are in the bariatric community, you should go. It's gonna be at the Aladdin Theater in October in Portland, and it's gonna be amazing. Tons of people are going out, and I'm definitely gonna be posting more about the event when I get a little bit more information, but that's pretty much all I know now. And I'm nominated for like 3 or 4 awards. So you guys, once I find out, please nominate, please submit. I would love to be a part of it, and I'm hoping that I get to be, considering that might be the month I get my surgery. So there's a lot of things up in the air, but obviously I'm just trying to make sure that getting this taken care of and getting my health back in order is my main priority. And I'm pretty blown away at how big of a process this is. And it seems like my surgeon's saying that the surgery won't seem too intense. What he wants to do, he gave me 3 options to choose from, which was reversing the gastric bypass, which I don't exactly feel the most comfortable with that. And after talking with a couple other surgeons, I feel like just the removal of the ulcer is gonna be the move to go, because the other options were just deal with the pain like I've been doing, and then the third one is to just cut out the portion of the stomach that has the ulcer. But with that, he wants to do a vagotomy, which is your vagus nerves. They connect down to your stomach and they produce extra acid, and he says that when I'm stressing, and because that's clearly an issue in my life, he says that he wants to snip those nerves. It scares me so bad. He wants to snip those nerves, and then that would help just with the extra production of acid in my stomach. So it really freaks me out to think about, like, these nerves connected to my brain, to my stomach, and he wants to snip them, plus remove a part of my stomach, which I guess like the main risk with that is if I ever did need to reverse my gastric bypass, they use your other stomach for that. And so now my accessory stomach is just getting smaller. And I asked him like how that would be, like, would I have to go back on a liquid diet, like the start of gastric bypass surgery? How does that work? And he said that it probably will be similar to recovering after you have had weight loss surgery. So I'm probably gonna be on like liquids and semi-soft foods and just being really safe and cautious and easy on my stomach. But he did say that when I got my gallbladder removed, because he removed the gallbladder thinking that all of these issues were a part of that, when I removed my gallbladder, I was only out of the gym for like a week and it really didn't even hurt. I asked him if that was going to be like the same. He said no, this recovery is a lot similar to the gastric bypass one. And I remember that pain probably lasted for a good month because of the staples in the stomach. So I don't really know if there will be any staples involved, but I know that getting your stomach stitched up, you feel that for a couple weeks. So I am anticipating being out of the gym probably for a couple weeks, which is gonna be fine. I'm ready to just get my health back. And I know I sound like a broken record, but that's pretty much what I have to expect and anticipate coming up. We've got the EKG, labs, and a bone density test. Then we will get scheduled for surgery, go through a little recovery, and be back to normal. So that is pretty much the update I have for you guys. I know that a lot of you guys have some questions about the medications that I've been taking, because I know I'm not the only one dealing with this, and a lot of us have been given all these different medications. And if you're like me and you were just given a surgery thinking that this was going to solve the problem, a lot of people are dealing with this right now. And it's crazy because I can't find any information on YouTube, on Instagram about anyone going through the same thing, besides people telling me in my DMs and comments that, oh my gosh, that's happening to me too, but no one has any answers. So really, I am just doing my best to kind of share my experience out here. So if you guys do have any questions, I don't know if I'm like really hitting all the points that you guys would want to know, but I do want to keep you guys in the loop with this, because this is really scary and this is something that's happening a lot in the bariatric community, but something that no one really has answers for yet. So I kind of feel like a guinea pig, and I know that some of you guys also feel like a guinea pig, and we're all just kind of like learning and going through the motions of managing this pain on a daily basis. And I'm just hoping that by the end of all this, we just get some answers. And I just really want to continue keeping my journey an open book, so that way anyone else who's going through this can also get the help that they actually need and not go through the millions of trial and error like I am. So I hope that this video is helping at least one of you out there, and I am just extremely thankful for you guys for just being here and taking the time to even watch this video and caring about the update on my little tummy issues. I love you guys, and I'm so thankful for the support that you guys show me on a daily basis, and I'm so grateful that I don't feel like I'm going through this alone. So thank you so much for being here and for caring. I love you guys, and I will see you on the next one.